All right, so I'm BodyByBree or BreeAnna Cox, and I am a fitness nutrition specialist. I've been a personal trainer for over 18 years, and I feel like what kind of makes me unique is I really like to focus on a holistic approach, so we really incorporate the mind and the body and the nutrition so that you make it last for a lifetime. Melissa, I'm so excited you're here. This is so fun.
So fun. Happy to be here.
Okay, so Melissa, you are the owner of Contour Health.
Yes.
Tell everybody your background, what you do, what you specialize in.
Yep. So I'm a nurse practitioner. I have been a nurse practitioner for 8 years. I've dabbled in a variety of medical backgrounds. Most prominently in my medical history have been medical aesthetics, so Botox and filler, and medical weight loss. Started prescribing GLP agonists 2 years ago, about. Okay. And that, at this point, is primarily what I do.
Okay, so you would say you're an expert in the field of GLP-1s.
Gosh, that phrase makes me a little uncomfortable, but I would bet I've prescribed them significantly more than most.
Okay, well, I'm excited to pick your brain because we kind of talked about this before, but I was like, listen, Melissa, I've been against GLP-1s since I heard about them, only because what I saw was my friends throwing up and losing too much weight and losing all their muscle and feeling sick and their hair falling out. And that's all I knew. That's all I attributed it to. So I'm like, no, we're not trading being healthy for being skinny. No way.
Couldn't agree more.
Right?
Yeah.
So that's all I've known. But I started researching. I went on this little journey and I was like, okay, this is kind of like the new wave of what everybody's doing. Let's see what it's all about. So I started researching and digging deeper and talking to some of my friends that actually look really good, feel amazing. They've seen some awesome benefits. And I was like, okay, there's gotta be something to this that I'm missing. So I want you to really educate all of my followers. I even asked them, what questions do you want me to ask Melissa? And what are you curious about? And what things have you heard? And we're gonna just get down to it. I wanna hear all the good, the bad, the ugly, the benefits, everything.
Let's do it.
Okay, so let's start with the difference between semaglutide and tirzepatide, because I feel like those are kind of the ones we're talking about.
Yep.
In this interview, we're not going to focus on the Ozempic or, people who actually do have type 2 diabetes and they do need this medication. It's more for the people that are not qualified through insurance to get the medication and what it looks like for them.
So let's back up a little bit. So both semaglutide and tirzepatide are part of a class of medications called GLP-1 agonists. GLP is the hormone that your brain produces after you've eaten a meal that tells your brain you're full, stop eating. So the easiest way to understand what these medications do is you get full faster and you stay full longer. That signal to your brain of you're full, stop eating is just exponentially stronger than it is at baseline. The other aspect to these medications, they work directly on your liver and pancreas to affect your insulin and your glucagon production. And the combination of the decreased appetite in conjunction with the controlled glucose levels comes together really nicely to help people lose weight. So both semaglutide and tirzepatide do both of those things. The differences come in that tirzepatide is the second generation of the GLP agonists. And it works on both that GLP hormone axis as well as another hormone axis called GIP. And that the two hormone axes results in fewer side effects and more weight loss. So if you look at the original studies of Ozempic, which is semaglutide, people lost 10 to 15% of their total body weight. And on Mounjaro, which is tirzepatide, it was 15 to 20. So more effective, fewer side effects.
Okay.
Yep.
That is interesting because a lot of my friends that started on semaglutide said they were throwing up or it made them sick or they just didn't like how they felt. They didn't really want to eat. Do you think that's just because they had too high of a dose? Or do you think that it seems like all my friends that are on tirzepatide really love it? Yeah. They really love it more.
Tirzepatide is objectively the superior medication. Okay. Like objectively, it is the superior medication. However, just because tirzepatide is a better medication doesn't mean that semaglutide is a bad medication, right? I genuinely put my stamp of approval behind both. Semaglutide is more affordable. And so if that's your option, that's great. Semaglutide has helped so many people. I have lots of patients on semaglutide that have done really well. They've lost a lot of weight. They feel so much better. It's helped them a ton. And so I genuinely approve both.
Okay.
Tirzepatide is the superior medication. Okay. Both of those things are true.
Got it. So why do you think that I don't think we need these medications, but why do you think that people are turning to these medications now?
So pharmaceutical companies haven't touched medical weight loss for a really long time. We were all the generation of the fen-phen debacle, right? Like it was a thing when we were kids, and ever since fen-phen, they've been terrified of it. And so there hasn't been any advancement in the world of medical weight loss for a long time. And then these medications started to hit, and they actually blew up because they hit Hollywood. There were movie stars that started to drop weight that had previously always struggled with their weight, and they became vocal about it. Oprah being one of them, she came out and did a full episode on the weight loss revolution. And then there were a few others. I don't know if Mindy Kaling has admitted to it, but I know that that's like a highly
You can usually tell when people are on it.
or
Christina Aguilera,
Kelly Clarkson's another
Kim
one.
Kardashian.
Like, a lot of them who have historically struggled with their weight all of a sudden looked really good and significantly thinner. And so that was where it all started. And it started 2-3 years ago. And then it's just become like, honestly, the biggest tidal wave in medical history since then.
Yeah, it's insane.
Of our generation, I should say. It's a tidal wave of our generation in medical history.
So what's the difference between people using it for type 2 diabetes and people using it to lose maybe 30 pounds?
Nothing.
Would it be dosing?
It's the same medication, right? But yes, dosing. So what I have found is, depending on where we're starting, often can be a precursor to how much medication you need in order for us to really get traction with weight loss. There's a lot of talk out there about microdosing right now, and that is using essentially a subtherapeutic dose, so less than what the starting dose is, to help you maintain your weight. There's a lot of benefits to microdosing. But the important thing to know is that if you've always struggled with being overweight or obese, or you're a type 2 diabetic, microdosing isn't going to work. You need a more significant correction, because you clearly have something that is metabolically broken within your gut.
Okay, so if they maybe only need to lose 30 pounds, or like some of my friends have done it and they only needed to lose 20 pounds and they were microdosing, it's just a different dose of how much you prescribe depending on that.
Exactly.
Okay.
So the way I do it is my patients get a vial of medication. And that vial has a specific number of units in it, and we start on the starting dose. And then depending on how they do, we can increase or decrease depending on how much weight they're losing, how they're feeling as far as side effects, what's going on, how comfortable they are with losing slowly. I have some people who are like, I'm only losing 1 pound a week. I want this to go faster. And it's like, okay, we can use more medication. We can make you lose 2 pounds a week. That's fine. And then I have others who are like, I am so good with going slow. 1 pound a week is great. I want to stay on the microdose. That's also great. It's a collaborative effort between me and my patients.
Okay, I love that, because my biggest beef with it before I truly understood was anytime you're sacrificing muscle to weigh less, there's a problem there.
Yeah.
And because for me, muscle is your metabolism, your hormone regulation, your fountain of youth, your longevity. It's like your health marker. Yep. So I'm thinking, if we're sacrificing muscle to be skinnier, this is not healthy. But from what you told me, there is a way to do it in a healthy way where we're slowly tapering down. And as long as they're lifting, from what I can see, as long as they're lifting and as long as they're hitting enough protein and hitting their base metabolic calories, then they should not be losing a ton of muscle.
Correct. So anytime we're talking about weight loss, people lose muscle. They lose a little bit of muscle. The theory behind why that happens is your body weighs less. You need less muscle to carry your body around. That seems intuitive, right? The important thing is that we want the ratios of how much muscle and how much fat you're losing to be a healthy ratio, right? We don't want you to lose more than 10, maybe 20% of the weight to be muscle. We want to make sure that the majority of the weight that is coming off is fat. And the most important aspect to making sure that we are doing this in a healthy way is eat protein, lift weights.
Yes, which I agree with. The funny thing is, even if people are doing macros, or let's say they're competing and they're on a really low calorie restriction diet, like 1,200 calories, they can still lose muscle because they're eating so low.
Yep.
And they can also gain the weight back if they're not careful about slowly reversing out. So all of the questions when I polled my audience, every single question that I got, I would say maybe 80% was, well, what do you do when you're off? Like, let's say you take the drugs, you hit your goal weight, then do all the cravings just come back? Do you gain the weight back? Like, how do you control that?
So I want to touch on a couple of things. I want to back up for a second. The reason that maintaining your muscle mass is so important, it feels very obvious, but you have to remember that if you go on these medications, you lose a bunch of muscle mass, you go off the medication, you don't maintain that lifestyle, now all of a sudden your basal metabolic rate that you burn of calories day to day is lower, and you're returning to your previous baseline lifestyle, so you're actually going to put on more weight. So the key to doing this successfully is to make sure that you're maintaining your muscle mass. Now, when coming off the medication, I tell people generally they have 3 options. Nobody really starts on a GLP and is like, yeah, I'm going to go on this and I'm going to stay on it forever. Nobody wants to do that. That's not what anybody wants to hear. And I think that's a lot of people's hesitation, is because there is that narrative out there of you just go on it and you stay on it, which is also okay with me, but let me talk you through it. So there's 3 options. Option number 1, you can get down to your goal weight and then slowly taper off the medication. Maintaining weight is easier than losing weight, and so that's totally an option. The important thing to know about weight loss is the only permanent fix to weight loss is permanent lifestyle change. So if you slowly return to your previous baseline lifestyle of what you were doing before the medication, you're going to slowly return to your previous baseline weight. Option number 1, go on the medication, slowly come off, try to maintain, but be aware that if we go back to our baseline lifestyle, we will return there, right? Option number 2, go on it and stay on it, whether that looks like a microdose or a maintenance dose, or, you know, if you're a type 2 diabetic or if you've struggled with obesity, you're just on it. You're on it because that it's correcting something metabolically broken in you. And so you go on it and you stay on it. The important thing to know is that these medications were FDA approved for people to be on them for the rest of their life. So when the FDA was evaluating the safety of these medications, that was the assumption that they were functioning under, is people are going to go on this and they're going to stay on it. We're approving it for obesity and type 2 diabetes. So they are safe to go on and stay on.
Even if you don't have type 2 diabetes though?
Yes.
Okay.
Yes.
Because that's my question, is like, if we're, just doing it for the last 30 pounds, is that okay to be on like a microdose for a super long period of time?
So far, the answer to that question is yes.
Okay.
Now, I tell people that what we know of these medications at this point is they look really impressive and super safe. Is it possible that now that we have so many more patients on these medications, our sample size has increased exponentially? So is it possible that we're going to learn something new about these medications in the next few years? Yeah, of course. We have way more patients on them. Of course, we're going to learn more about them, right? But the data right now looks extremely promising and they are very safe.
And I do feel like that's something to address, is like, you do have to take into consideration there's risk with any medication that you take.
Correct.
So you have to think, is this worth the risk of the medication to lose the 30 pounds? Or, can I do it on my own? Or do I feel like I do need a little bit of help? So I like that you address that.
I also want to circle back just because, so there's 3 ways, right? Maintain your weight on your own, stay on a low dose. The other option is you come off of it knowing that it's possible that you're going to slowly gain that weight back, and then you just have a threshold in your head of, I don't want to get however far away from my goal, and then we can do it again. Now, is that the healthiest way to do weight loss? No, of course not. But it is an option.
Well, and I think that's why I got so passionate about it, because I was seeing some of my friends do it, and I was like, I could help you do this in such a healthier way, where I can help you lift and help you make sure you're eating enough, make sure you're getting enough of the protein, and you're not upping your dose if you're losing it too fast, And so I saw that if they were able to learn the healthy lifestyle and actually change their habits, which I don't see a ton of practitioners doing right now, is marrying the two, is being like, okay, here's the tirzepatide, and then here's a lifting program and a nutrition program. I don't see that very often. Do you see that?
No. I mean, honestly, there are a lot. So the safety of the medications, to a certain extent, is working to the medication's detriment because they are so safe. There are a lot of providers throwing them around irresponsibly. And they can get away with it because the medication is so safe, which is really unfortunate. But yes, I mean, I have looked at dozens and dozens and dozens of different companies that are prescribing GLP medications, and there's a lot of them out there that are doing it poorly. They're not guiding their patients. They're not guiding them on dose. They're not helping them understand the importance of protein and muscle mass, and and it's just kind of a cash grab. And you fill out this form and we'll mail you medication.
Yeah. Well, and two, people get really excited about the weight loss and they want it to be quicker and quicker.
Also true.
So they're like, up my dose.
They're spending a lot of money. And so if they're spending a lot of money, they're like, I want this to come off really quick, which I can empathize with, but that's not the best way.
Yeah. And that's where I'm like, I think my passion came from being like, I would love to educate these people on why you don't want to lose too quickly, why you want to keep your muscle mass. So I love that you're making sure that tell me what you're doing to make sure that people are not losing too quickly so that they don't lose their muscle mass.
So I start everybody on the starting dose. And then after they've been on the starting dose for 2 weeks, they check in with me. They send me a message and they tell me how much weight they've lost, what dose they've been doing, and how they've felt as far as side effects. And then I guide them with their dose from there. In theory, if I have a patient who's lost 6 pounds in a week, we need to back off their dose. That's way too much, right? And it's pretty common for the weight loss to go really quickly, like the first 2 weeks, and then for things to slow down. Mm-hmm. But do I want you losing that much weight week over week? No, absolutely not, right? You need less medication. Your body is clearly very sensitive to this medication. Let's back off. And then, so they touch base with me after 2 weeks. I am available to them to continue to touch base with if they're sick and struggling with side effects, if they need help with their dose, if they have other questions. And then my safety net to make sure that I am touching base with my patients and we are doing this in a healthy way is I don't provide refills automatically. They have to reach out to me in order to get a refill. I have to have an updated weight and an updated dose so that we're touching base. You can't go more than a couple of months without talking to me.
I love that. That's great. So let's talk about, I'm going to tell you 2 examples. So I have one client that did tirzepatide. She lost 60 pounds and 3 of those pounds were muscle.
That's impressive.
It's amazing. And it was because what she did was she was every month doing a body scan. If her muscle mass was going down, she would stay. She would not up her dose.
Makes sense.
She lifted 4 to 5 times a week and she hit her protein. And I was like, okay, so it is possible.
It absolutely can be done.
So it is possible. Absolutely. Well, then I had another client who was on semaglutide for 9 months. She lost 65 pounds and her hair was falling out. She was throwing up every day. She felt horrible. She had no energy. And so I want to talk about both sides. So let's talk about the pros and the cons. Like, what are some things that they need to look out for to know that, okay, these are some of the risks and these are some of the things that can happen, because it could be really dangerous if you abuse it.
Yeah.
So what are some of the things that people need to look out for could be risks?
The con that is screaming at me when you talk about your friend who lost hair, muscle mass, all of the things is that's not weight loss, that's malnourishment.
Yes.
And there's a difference.
I'm basically just starving myself.
There's a difference between weight loss and malnourishment. And hair loss is a thing that people talk about, and that is a malnourishment issue. That is not a GLP issue. That's you're malnourished. So same concept. We need to make sure that we're losing at a reasonable pace. Are we having enough? Are we eating enough calories? Are we still getting our nutritional buckets? Are we getting our protein? Are we going nice and slow? Are we doing this in a healthy and sustainable way? Malnourishment is the con that is just screaming at me.
Right.
As far as the pros of the medication, honest to goodness, I feel like there are more every week. Like there are articles that are being produced about the benefits of these medications left and right. There's an article in the Wall Street Journal recently about that it helps protect your kidneys. There are tons of articles about preventing risk of stroke, preventing cardiac disease, preventing obviously type 2 diabetes. I have a lot of patients who have PCOS. They have that underlying issue of insulin resistance. Insulin resistance makes it extremely difficult to lose weight. Patients who have PCOS have often battled their weight their entire life. We address that insulin resistance through these medications, through working directly on your liver and pancreas. They lose weight, but they also feel better. They feel better. And part of the reason that happens is because your body becomes so much more effective at producing the insulin in a slow, steady manner. So it's like it's kind of like a microdose. You produce, instead of a bunch of insulin at once that you're dumping into your body, you're producing a little bit. You're producing a little bit as you go along. And the result of that is that you level out your blood glucose levels. You don't have these spikes and dips. That has an anti-inflammatory effect on your body head to toe. So a lot of the benefits that we're seeing come back to that anti-inflammatory component. I have patients who say they really have struggled with irritable bowels and that this has helped significantly. I have patients who have Crohn's disease that have said that this has helped. I have a patient right now who has rheumatoid arthritis and she wants to try it out for the inflammation benefit.
Interesting. I didn't know that.
A lot of the benefits that continue to come out are related to that inflammation piece.
Interesting. Yeah, anytime you lower inflammation, that's a good thing.
Always.
So, okay, these are some of the questions that my followers were asking that they want to know. One was the gastrointestinal paralysis.
Okay.
How do you avoid it and what is it? So let's educate our listeners on what that is.
Yep. So stomach paralysis is when your stomach just stops emptying your food. The medications do delay gastric emptying. That is one of the functions of the medication because that helps you stay full longer. But there's a difference between delayed gastric emptying and stomach paralysis. Stomach paralysis is something we know it happens. We've seen it in the literature. I personally have never seen any of my patients have stomach paralysis. And my colleagues that also prescribe these medications, none of them have ever seen it firsthand. So it's really very, very rare.
What causes it? Just too high of a dose or what they're eating or what?
Yeah, and I mean, there's always risk with any medication, right?
Yeah, just how their body reacts to the medication.
Yeah, I mean, it would be highly correlated with a higher dose. And, you know, typically these are patients who have a long way to go as far as their weight loss journey or correcting their type 2 diabetes, or there are other underlying health issues at play that are also working against them. And then you kind of get this perfect storm for stomach paralysis.
So what about the delayed stomach emptying? Can that cause any issues?
No, that's honestly,
do you feel constipated?
beneficial.
Like, what do you feel?
Well, constipation is a side effect, can be a side effect, but
Okay.
the delayed gastric emptying and the constipation are two separate things.
Okay.
The delayed gastric emptying helps patients get full faster and stay full longer. Your food is sitting there, right? So you don't get the signal to your brain of you're hungry because it's still in there, and then it slowly makes its way through your intestines.
So question on that.
Yep.
Is there a risk, because my friend said she had to go to the hospital because it was delayed stomach emptying for too long and her food was rotting in her intestines, and so she had to go to the hospital. So how would we avoid that happening?
I mean, low dose, slower taper. I've never seen it. I would want to look at her. I would want to look at her medical history. There's a lot of pieces to that puzzle. I feel like I honestly can't say why that happened. I don't know her medical history. I don't know what the diagnosis was at the hospital. I don't like.
But that's
I'm not sure.
Something that you
it's
commonly
not. That
see.
is not common. No.
Okay.
That is for sure not a common report.
Okay, that's good to know. Yeah, because I feel like that was the main question, was that, and then the other question was, if you're taking an artificial GLP-1, when you get off, will your body stop producing it? Like when you take testosterone and you take it for a long period of time, your body stops producing testosterone on its own. Does that happen if you're on it for too high of a dose or for too long?
No. The only time people see issues with losing weight afterwards, like their ability to, if they go on the medication and then they go off the medication, they decrease their ability to lose weight on their own, that is usually related to the fact that you've lost too much muscle. Otherwise, things just go back to the way they were.
Like your metabolic rate is just lower now because you don't have the muscle that you used to have.
Correct.
Okay. How long do people usually stay on it on average?
Totally depends on how much weight they're trying to lose.
So do you recommend, if people can, do you recommend them tapering off of it or weaning off of it? Like once they hit their goal weight, would you be like, okay, let's try to get you off of this and see if you can continue your healthy lifestyle, or what's the protocol?
That's a good question. It's a collaborative effort. So it's patient preference. I genuinely believe that both options are safe. And so I will help my patient through whatever option, whatever avenue they're trying to take. Yep. Whether that looks like maintenance dosing, whether that looks like coming off, whatever that looks like, I'll guide you through it. And a huge piece of that is just patient preference. Again, going back to it, nobody starts the medication is like, oh, I'm going to stay on this. Like, that's not a thing. It is a pretty common patient experience for people to start it and have the food noise get quiet and have them not stress about their weight, their body image. What are they going to eat? How much are they going to eat? When are they going to eat it? Like, the food noise is so loud, right? And so they experience that quietness and also how much easier it is to control their appetite and to control their diet. And they're like, oh, actually, this is awesome. I'm okay. Like, maintenance dosing sounds great. That's a pretty common trajectory, a pretty common mental flip that happens just because it is so helpful. It is so helpful and people feel great. Not everyone.
Well, I was just going to ask I know some of my friends, they feel nauseous a lot of the time. Like, is that normal to feel nauseous?
So all of the side effects for both medications are all GI related. Constipation, nausea, vomiting, diarrhea, heartburn, fatigue. Those are the most common. The longer you stay on the medication, the fewer side effects you experience. So it is a common report that I get that people will start on the starting dose. They'll be a little bit nauseous the first couple of days, or they'll have diarrhea the first week, or whatever the case may be. And then as they stay on it longer and their body gets used to it, those side effects decrease. So yes, nausea is common. Like, yeah, absolutely. It is common. It happens less so on tirzepatide than with semaglutide. I've also found that how symptomatic somebody is often correlated to how much they're eating and what they are eating. And if you overeat, you will make yourself sick.
So one other question I had was about gut health. I'm super big on making sure you have good gut microbiome, and I'm always helping my clients to improve their gut microbiome. So how does it affect it?
It's honestly very beneficial. I have a lot of patients who have said, I've struggled with GI symptoms my entire life. Bloating is usually the biggest one. But irritable bowels, Crohn's, kind of what we were talking about. And it's very beneficial for your gut health. The belief for that is related to the anti-inflammatory component. If we can decrease the inflammation in the gut can function better.
Got it. Yeah. So who would be a good candidate for this and who would not be a good candidate? Do you ever turn someone away like, you would not be good for this?
Yes. The number one red flag to me is I always ask people our starting weight and our goal weight, and then we calculate BMIs accordingly. I don't believe that BMI is a great indicator of health. I'm going to throw that out there. However, I do know that when they give me a weight that puts them at a BMI of 18 or 19, we don't need to do that, right? That's unnecessary. Right. We have so many options before we get to that weight that are so much healthier. So that's usually my number one red flag. I care less about where we start, and I care more about where we're trying to go.
So who would be a good candidate then?
So good candidates are the best. My best favorite candidate is my patient who already has tried diet and exercise. They understand the concept of pairing their proteins with carbs. They understand how to get an adequate amount of protein. They understand nutrition, and they're active. That patient, you throw in a GLP and it all comes together beautifully.
So because they're the ones that aren't going to abuse it, they're not going to lose the muscle, they're going to be able to.
Yep. And they're the ones that are super frustrated. Yeah. Because they've been doing it, right? Yeah. They've been trying so hard for so long and they don't see the progress and they don't see the scale move and the food noise is so loud and I'm working so hard at the gym and I'm not seeing any progress. So why am I trying so hard? Right. And then we add in this medication and they're just so happy because they haven't seen progress in so long.
Yeah. So tell us about your journey on it. So you told me that you had been on tirzepatide.
Yes.
You're 9 months.
I've announced this on Instagram. This is not a secret.
Yes. You're 9 months postpartum. Can you do it while breastfeeding, or do you have to wait? I don't know if you're breastfeeding or not, but that is a question I know I'll get.
I'm not breastfeeding. It's a very common question. So the medications have been used for people breastfeeding, but only under the instances of type 2 diabetes and obesity.
Okay.
I don't recommend it while somebody's breastfeeding.
Yeah.
Let's have you stop breastfeeding and then we can go from there. Right. The belief is that it is safe because the peptide itself is too large to cross over into the breast milk. So the underlying belief is that it's safe, but I always recommend that we are done breastfeeding and then, enjoy your baby, enjoy your breastfeeding. Yeah. There's time, you're gonna be fine, you're gonna lose the weight, finish up what you wanna do with your baby, and then we'll go from there.
Yeah. So what was your experience with it?
So I have lost 30 pounds over the course of 6 to 7 months. I started on a super low dose. The starting dose of tirzepatide is 25 units. I started on 10. I went to 15 and then to 20 and then to 25. And I don't need to lose any more weight at this point. I'm very happy with where I'm at. I feel good. I feel healthy. And I'm working on finding my maintenance dose. So that usually looks like we're backing off the dose and we're watching what happens. So if we start to gain weight, we know that our maintenance dose might be a little bit higher than what we're currently doing. And if we are still unintentionally losing weight, we know we need to back off this medication. It's too much. So we can either back off the dose and you can continue to inject weekly, or you can spread your injections out. And which of those two options people use is, again, a lot of patient preference.
So I love that you said you lost 30 pounds in 6 to 7 months, not 2 months, not 8 weeks.
No, because if you're losing weight that fast, you don't feel well.
You feel
You're
horrible.
not like, you're not, nobody.
Yeah, I love that.
I never cared about my weight enough to make that sacrifice worth it. No, I don't want to live like that. Yes. Like that's not enjoyable. That's not fun. I knew that it would keep coming off. And so we just stuck with it. And if you stay on it long enough, you will continue to lose weight.
Well, and I love that we can educate people on the fact that it's good to go slow.
Yes.
It's good to go slow.
There's nothing wrong with slow.
Don't rush it. Don't try to lose too fast.
And it also, I have a lot of patients that will be like, I haven't lost weight in 2 weeks. And then they'll message me a week later and they're like, oh, I lost another 3 pounds. Mm-hmm. It's not linear, right? Like it can be a little bit chunky and you just have to be patient.
Right. So let's talk about the training side of this, like the physical fitness side of this. Because I had a conversation with you, Melissa, and I was like, hey, like what can we do for these clients that all these providers are saying you should lift and you should eat protein, but they have no guidance.
I'm guilty of that. Like I tell people in my onboarding video, I'm like, there's 2 things that the medication can't do for you. It can't build lean muscle mass and it can't provide you adequate nutrition. That's your job. There's nothing that can do that for you. That's your job. I tell them that.
Yeah.
And that's about it.
So that's why I feel...
But it's not my spike. It's not my area of expertise.
But it's good that you know that.
Yeah.
It's like you are in your line, and that's also why I'm like, I'm going to do an interview with an expert that does this every day. I'm not the expert. Yeah. I don't know. Yeah. I don't know how to do dosing. I don't know how to do any of that. What I do know is how to help people not lose muscle and to make sure that their macros are on track, right? And that's what I know. So I'm like, I do feel like there is a need for these clients that are on this medication to have some sort of guidance.
I totally agree. And I polled my audience on Instagram the other day and I said, would it interest you if, we offered some more guidance surrounding weightlifting and nutrition? And the resounding answer was yes. The question that I got that I actually feel like you're probably better at answering when I pulled my audience as far as what questions they have, the number one question was, how do I hit my protein goal if I have such a decreased appetite? Specifically days 2, 3, 4 after injection, you have a pretty decreased appetite. And so if we're trying to hit our protein goal, how are we doing that? I tell him to drink a protein shake. I tell him to go get the Fairlife chocolate milk at Costco.
And I'm like, BodyByBree protein. I'm just kidding.
You're going to be way better suited to answer that question.
Well, I would say, because my friend had that same problem and she was asking me, like, how do I get enough protein without eating meat? Meat was really hard for her at the beginning. So I was coming up with recipes like, okay, well, we can do the cottage cheese protein pancakes where it's not meat, but it has 30 grams of protein, or Greek yogurt parfaits, you know, like there's so many other things. You can do overnight oats with the protein powder in them. My biggest thing is I don't want my clients relying on protein powder and protein bars. Like, I want them to try to get it from real sources. So I will teach them, put hemp hearts in your shake, you know, because that'll add 10 more grams of protein.
Well, and you're also going to hit your other nutritional buckets in so doing.
Exactly.
If you get your protein from whole sources of food, you're also getting nutrition from those whole sources of food.
Exactly.
I couldn't agree more.
And shameless plug, BodyByBree protein. It's the best. It's organic. It'll help you hit your protein goals.
I love it. Atta girl.
But no, I do see a huge need for that. I do see that that's something that's lacking. I really think that it could possibly be a good thing if they're mixing the lifting, the protein, the fiber,
Yep.
and then the microdose of tirzepatide, or you know, where they're losing steadily.
And I mean, you would have a perfect insight into this of there are people who hit their macros and work out and still don't lose the weight, right? There is something metabolic there that is happening, probably some degree of insulin resistance. And those are my favorite kind of patients, because we put the last piece to the puzzle and it all starts to come together.
Well, to me, that shows me that, like you said, something's off, usually hormones. And so I'm wondering, do you think it helps with hormone regulation? Like with PCOS, when you're regulating?
So it helps with PCOS because it addresses insulin resistance.
Okay.
When we talk about hormones, we usually think of estrogen, progesterone, testosterone. GLP is also a hormone, and insulin is also a hormone. So does it affect hormones? Yeah, it affects your glucagon and insulin and your GLP. Yes, it absolutely affects your hormones. Does it affect your estrogen and progesterone? The research says no. Do I have anecdotal instances where patients report different things regarding their hormones? Yes, but the literature doesn't support that for the time being.
That's good to know.
Yep.
Okay, do you have any other questions for me on lifting, protein, collaborating, anything that you think your patients would need to know on the fitness side?
Oh, there actually is one. So the other question that I get often is, what about cardio on GLP medications? And I know you're a big advocate for weightlifting. I tell my patients, less cardio, more weightlifting.
Yes.
You're going to be in calorie deficit because your appetite is going to be decreased. You don't need to go and burn a ton of calories on the treadmill. You need to maintain your muscle mass.
Yes, exactly. And if you are in too big of a deficit and doing cardio, you will definitely lose the muscle.
You'll lose too much weight, and you'll lose too much weight.
Yeah. So when we train clients that are on GLP-1s, we say, don't do the cardio and just do the weightlifting. And then what we will do also, if a client comes in and they tell us that they are on GLP-1 medication, first we will calculate their base metabolic rate. So we know we want you to hit at least this base metabolic rate so that you're not losing muscle and so that you feel your best. So once they have that,
so you're not malnourished.
And so you're not malnourished, exactly. And once they have that, we'll then give them their target protein goal, and it's usually a range because, as you know, some days you feel better than others.
Yep.
So we'll give them a target protein goal, and we talk about fiber to try to help your digestive system.
I love it.
So, and then what we'll do is put them on a very structured lifting program where it's very minimal cardio. We focus on one to two body parts a day, so they're muscle splits, so that they actually have time to tone and develop those muscles. So instead of doing,
I need your help.
yeah, I would love to help you. But instead of doing like full body like HIIT workouts or like an Orange Theory, like that is not what they want to do. Not an F45 workout. We don't want to be doing those workouts. We would love to have you be doing muscle splits where you're doing legs one day, shoulders one day, back and bis one day, and you're doing supersets. And there's a very specific way that we can help you not lose the muscle so that you're actually being able to tone instead of just get
love it.
skinnier, right? We don't want
love
to
it.
trade, we don't want to be skinny fat. That's what we're trying to avoid.
No.
So that's what we do for our
That's what I
clients.
currently am.
No, you are not. You look amazing. You look amazing.
I do. I need to put on muscle. But yeah, I mean, I think that the awesome thing about this podcast and us having this conversation is that you have a skill set and I have a skill set, right? And we both understand that we should stay in our own lane, but both pieces are necessary to come together in order to have an optimal experience.
Yes. And I truly believe too, there is a huge mental component to all of this. Like,
Huge.
If you have a very unhealthy relationship with food, if you're not doing the mental side, that's where we come in as well, is we actually have habit coaching and mental exercises, and we're doing mindfulness and meditations to help you heal your relationship with your body, and teaching you how to get rid of the all or nothing mentality and getting rid of that restriction and how you speak to yourself. And all, if you're not doing that, the biggest piece, then you will never overcome your weight loss. Like, that is so big. And so I do feel like that mental piece, along with the lifting, along with the tirzepatide, it could be like a killer combo if people are willing to do it.
Yep. I will say about the mental piece, I agree with you. I want my patients to have the skill sets of knowing what to eat, what to ratio, how to get nutrients. Like, we need those foundational bricks. My patients who have struggled with being overweight and being obese their entire lives, that mental noise for them is just so loud, and always has been, right? So learning the coping strategies, yes, like absolutely. Learning healthy habits, all of those things are really important. I have had an overwhelming response in a very positive way of patients who have previously struggled so much with that food noise, and it just improves. It gets better.
That's
it
amazing.
gets easier. Yeah. So,
That's
you know,
amazing.
you need the building blocks. You need the
Yes.
foundation, and then you add in the medication, and all of that food noise goes quiet, and it's easier. It's
And also,
great. 10 out of 10, do recommend.
Yeah, well, and then also, like, once you do get your dream body and you feel amazing, some people, if they haven't done the mental work, they're never happy. It doesn't matter how good
Absolutely
they look,
true.
they keep going and they
Absolutely
keep going.
true.
And so it's like, let's work on the mental, the physical, the emotional all together.
That's honestly how I feel when somebody tells me that they want to have a BMI of 18. I'm
Yeah.
like, I don't actually think that's going to make you happy. I don't actually think that a GLP is what you need.
Right. I love that. I love that you're being so responsible with it. Okay, so with all of the hype that's going on with these medications, what's the one thing that you want people to consider before they jump on this bandwagon?
I would just say pick your provider carefully. With all of the people out there prescribing them, I mean, you can get a GLP from almost anyone on any corner these days, right? All of the experiences are not created equal, so do your due diligence and pick your provider carefully.
Yeah, I that's what I've actually seen is people who, they just get it shipped to their door and they have no guidance and they just kind of run with it, and that's when you see the horror stories.
I do it via telemedicine. It's interesting. There are kind of two models for people who are prescribing GLPs. You either do it in person and you go to a doctor's office and you get on the scale and you do the injection in the office and they give you the syringes, and that's great. There's more hand holding there, which is great. And then there's telemedicine. And most of the telemedicine companies, it's ship it to your door, right? It's lack of education, lack of access to a healthcare provider, lack of somebody that you can ask the questions to, lack of somebody who can help you if you're super sick. And I think what makes our company unique is that we have found a good crossover between the two. So we'll help you, we'll hold your hand, we'll educate you. We're gonna make sure that you understand what you're doing, you understand the medication, you understand your dosing, you have somebody that you can ask your questions to, and you don't have to go to a doctor's office, and you can do it from your house, and you can get it shipped to your door.
So how can people find more information on you if they want to contact you?
So our website, my company is called Contour Health. Our website is www.contourhealthrx.com.
If any of your clients are interested in getting a nutrition program or having like this specific weightlifting program, they can go to BodyByBree.com or BodyByBree Fitness.
Amazing. So I I have said this before, I've been very vocal about this, but I am not a weight training specialist. I need help. So I've actually recently started your program.
I'm so excited for you.
I bought it a few nights ago. I bought some dumbbells on Amazon. So I'm going to go on a journey the same way you've gone on a journey.
Yay.
And we also have a way to help out my patients. If they want to come and see you, they can use Salty10. I'm Salty Injector on Instagram, because I have kind of a snarky personality. And so you can use the code SALTY10 and you can get 10% off of one of Bree's programs.
Perfect. I'm so excited. You're going to love it. You're going to kill it.
Thank you.
Love it.
I hope so. And if anybody wants to come and see, I have 2 other nurse practitioners as well who I've employed and trained, and they're wonderful. If anybody wants to come and see me and my team, they can tell us that they found us from BodyByBree, use the code BodyByBree, and they'll get 10% off their first vial.
Thank you so much for coming, Melissa.
Thank you
That
for
was
having me. This is fun.
super helpful, very informative. I'm hoping that we can just present this information, let people kind of decide what they want based off of the information, and I think it was super helpful.